Alright buddy, welcome back to Table Talk LA. Today we'll be talking about the hip muscles. We're going to be talking about the iliacus. We're going to be talking about the TFL, and also we'll be talking about the psoas muscle group. Now, as we know, the psoas muscles, one of the tightest hip flexors, just because we sit all day and the psoas is at a shortened state while sitting. A lot of therapists will go through the belly, the abdomen to hit the psoas muscle to get a release, as they say. But I found a different approach that does the same work without causing too much tension and trouble to the client. And that's with working with the iliacus and working with the ASIS, which is the bone protruding at the anterior aspect of the hip. After warming the muscle properly, we're going to be going a little bit deeper into the muscle. We're working with the proximal aspect of the quad, which is another hip flexor, so we're going to be loosening that up as much as we can. We are not going to be going through the belly into the psoas muscle, while we're going to be working with the attachments to the iliacus. This will cause a lot of release down the quad and into her hip. So we're going to have her sit up just to recess the hip and see where the hip exactly is going to be facing. Now we're going to be looking at the knee. If the knee is too up in the air, then we know we're going to need some more work. And if the hip drops, then we should be fine. Now, as I remember looking back at this video, I wasn't happy with quite where the hip was laying. I could still see it kind of protruding a little bit up in the air. So we're going to have her lay back down, and we're going to go ahead with some cupping therapy. Again, let's talk about draping. This is very important. We want to be able to reach that iliacus muscle, and the iliacus is pretty far up high. So what I usually have my clients wear are sports shorts or some sort of tight draping, just so we're able to get that iliacus, because it is pretty high and the ASIS is pretty high, so you want to be mindful and careful. The cupping therapy provided here is called sliding cupping. It's going to help to warm the muscles, create some elasticity in the fascias, getting it ready for our static cupping session. Our next step will be static cupping. It involves the cups in a coordinated fashion being placed on top of the fascia for about 5 to 10 minutes. Now we could see that there's going to be a lot of discoloration, and you want to remove the cups if they get too red. The placement of the cups will depend primarily on what you're trying to accomplish. For this case, we're trying to get the hip flexors to relax, so we're going to be putting a lot of cups on the quads. We're going to be putting a lot of cups on the upper hip. We're going to go lateral into the TFL as well. Very important during this process, we're looking at the cups to make sure the cups are not getting too dark. That could cause a lot of bruising and potentially injure the client as well. You might be thinking to yourself, this is an excessive amount of cupping. It is not. Please, as I was saying, go to a certified specialist that knows what they're doing to place the cups properly, so that, again, the client does not get injured. So again, we're going to let the cups sit on for about 5-10 minutes. We'll be coming back with part 10, taking off the cups and showing you guys the results.